different today. We are doing a live remote broadcast from the Mobile, Alabama cruise terminal. And this is the location that we use for many of our large-scale vaccination events. And it has been an incredible place to be, and we have received so much in terms of support from not only the Mobile, Alabama cruise staff, but also the Sheriff's Department and City of Mobile Police Department that really have made this operation just extremely successful for us, and we've been able to deliver a large number of vaccines each day that we're here, and you'll see that we'll announce them either as your first dose or your second dose clinics, but this has kind of been our home away from home a lot of the days that we're not in the office. So just a couple of notes. I'll start with the numbers. So in the last 24 hours, we had just over 36,000 cumulative COVID-19 cases reported in Mobile County. That was up by 41. The number hospitalized is at 4638, which was an increase of 15. And our mortality in the last 24 hours from COVID-19 was up 3. I think what's important about these numbers is we look at them daily and look at the weekly progression of each of these metrics. We're seeing a very substantial downtrend in cases and hospitalizations, and we're now starting to see the downward trend in mortality. As you guys will remember, we see a very distinct pattern where when cases increase, we then 2 weeks later see increases in hospitalizations, and then about 10 to 14 days from that, we see the increases in mortality. So we're seeing a very pronounced decrease. We are seeing some very encouraging numbers coming off the highs that we're seeing coming off the end of the year holidays. The metric that we also look at quite intently is the number of current hospitalizations. And in the last 24 hours, this number fell by 3. So we were at 87 when the count was done over the last 24 hours. And again, what's important here is this is the number that tells us what effect COVID-19 is having on our hospital systems and healthcare delivery in Mobile County. So again, very encouraging numbers, very encouraging trends that we're seeing. We're still not at the lows that we saw in September and October of 2020, but we are making very, very good progress there. So just a couple of updates before we get to the questions that you guys are sending in. So we do want to announce that we have a first dose clinic in Saraland tomorrow, which will run from 9 a.m. until our vaccine supply is exhausted. The location is at Redemption Church. This is at 158 and I-65. It's a very, very large church, and this will be a drive-through event. So first dose, Saraland Redemption Church, and a drive-through setup. So we will see y'all there. I think it's important for this one, for those of you that are going to come out to Saraland, please pay particular attention to the traffic directions. We have a map of the traffic flow that's on our website at mchdcares.com. You can look at that, but also please pay attention to the Saraland Police Department and how they're directing traffic. They are not going to allow individuals to queue the night before just because of how busy the intersection there is on Industrial Highway or 158 and Redemption Church. So please do not try to queue extremely early. They're going to start letting people line up about 7:30 tomorrow morning, and then bring them into the church parking lot for us to begin vaccinations. The other thing, let me just quickly say that we really do appreciate all the support that we've been getting from the other metro areas, from the police departments and the mayoral staff. Has just been incredible when we do these events. Okay, so in terms of our media questions, we had a question around how we're testing for the new variants that are being reported here in the Mobile area. So if you will remember what a variant is for SARS-CoV-2, which is the virus that causes COVID-19, it's a change in the genetics of the RNA strands. Those changes actually translate into how that virus actually ends up looking once it's complete. And those changes can either make no difference at all, it can hurt the virus where it actually ends up dying out, or it can make the virus genetically more favorable in terms of either transmission, which we will look at as a bad thing, but for the virus to be able to be transmitted more efficiently, cause higher levels of mortality, evade treatment, those types of things are what we talk about when we talk about variants. The variant that we are seeing here in Alabama is the variant that was identified in the UK. So this is B117. There are 2 additional variants that are circulating. We have not seen them in Alabama or in Mobile specifically to date. These are the strains that were initially identified in South Africa and in Brazil, as well as Japan, kind of at the same time. So our question was, how are local urgent cares testing for these? So the test that you have to use for looking for these variants is different than the diagnostic test that is done by PCR. So this is a genetic sequencing test that's also performed by PCR, but it looks at how the bases are lined up in the genetic strain. This is a very difficult test to do. It has to be done by laboratories that have a certain level of sophistication and technology, and this is not available at local urgent cares. What that translates into is the number of samples that come from the cases that have been tested for these variants is less than 1% nationally. The CDC at the beginning of this month was only doing a handful of tests. Now they're doing almost 10,000 a week, but this is a slow process. It's also expensive to do, and so part of the CDC program is to increase testing through federal funding. So if you go to an urgent care and they do a PCR test on you, that's going to be a diagnostic test. It is not going to be a genetic sequencing test looking for the variants. In terms of testing, I said that we were less than 1% in terms of total samples that are being done. This is far beyond what other countries are doing. We are roughly in the lower 40s, like we're number 43 in the world with respect to sampling. But most countries are, even in the best circumstances, less than 20%. There are a couple of countries that are doing higher levels there. So we are not doing enough testing for variants. Questions about the Johnson & Johnson vaccine. And so the J&J vaccine was approved this week in terms of the advisory committees looking at Johnson & Johnson's safety and efficacy, and it was deemed both to be positive. FDA is meeting as we speak today to determine if they will give approval. Also, there is an evaluation that will occur looking at how J&J's vaccine is going to fit into vaccine delivery. What is encouraging about Johnson & Johnson's vaccine is that it is easier to handle. It is a single dose vaccine, and it can be essentially given to more places for distribution than the Moderna and Pfizer. It has very good efficacy and safety with a single dose. J&J is doing a parallel study looking at a 2-dose regimen, so we'll look at that. But more information on how J&J will be made available, who will have it, and how it will fit into the armamentarium will be coming soon. We had another question about the vaccines. Will you get an option to choose under the current paradigm of vaccine delivery? No, you will not. The recommendation, though, that we say is if you have a vaccine available to you, regardless of who the manufacturer is, please take it. It's very important with respect to these new variants that are out there that we get as many people vaccinated as quickly as possible. We consistently get questions about eligibility. And, the big question that we see probably more often than not is that I'm under 65 and I have an underlying condition. When can we be vaccinated? So currently, according to Alabama Department of Public Health, that falls under the eligibility phase of 1C. So that will be the next phase that will open up. So these are individuals that are 65 years of age and under with underlying conditions. And in terms of the earliest ages, it's 16 for Pfizer, it's 18 for Moderna. So that will be the next band that's opened up. A lot of questions about what the occupation qualifications are, and if I'm driving a bus or driving Uber or whatnot. You can go on Alabama Department of Public Health's website and it will give you a breakdown there. But if you're having high contact with the public, you right now probably do qualify, but just double check that with you. I had some questions around, when we give you a card, it has on there when you are to come back. And for Moderna, it's 28 days later. We also, on your card, it will say that Mobile County Health Department vaccinated you and it was with the Moderna vaccine. So questions about, can I come a couple of days early? What happens if I miss my dates and it's longer, that type of thing. The current recommendations are that under circumstances that cannot be addressed, you can come 4 days earlier. Typically, though, the way that the clinics are done is you won't have a clinic on that day for a second dose. The other aspect is the way vaccine distribution is done from Alabama Department of Public Health. If we did not vaccinate you for your first dose, we cannot vaccinate you for your second dose, because what happens is that basically takes away a vaccination for someone that we have already vaccinated with their primary dose, and we have an ethical commitment to those individuals that we have delivered their first dose. So I hope that helps with that. So that one is a repeat. All right, so I'll just want to reemphasize though, in terms of your second dose, you need to go back to who vaccinated you on your first dose, the place that you were vaccinated, and at least 28 days with Moderna, but from your first dose. There is no upper limit if you do miss that, 28 days. There's some recommendations that are 3 to 4 weeks past that. That's because of the clinical trials. But as of right now, if you're not vaccinated in that time point, you do not have to restart the series. Okay, so anything else? We're good? Okay. All right, guys. Well, thank you very much. Again, very nice day out here at the Mobile, Alabama Cruise Terminal. We'll be back on Monday with